If bending forward lights up your lower back, you're not alone. It's one of the most common issues when dealing with back pain. But most people go about fixing this in completely the wrong way. In this video, we'll talk about why you get back pain with bending forward, what to do about it, and importantly, what not to do about it. If you're new here, welcome. My name is Nate. I'm a doctor of physical therapy and the founder of BackUnbroken, where I help people get out of debilitating back pain every single day. Okay, so back pain with bending forward. Oftentimes, this shows up with just simple everyday activities. Maybe you're unloading the dishwasher or doing the laundry, putting on your socks, or even doing something like brushing your teeth. But that movement of bending forward into what we call flexion is a really common trigger for people with back pain. And oftentimes, this is a protective or guarding response in your body. You might have had a significant injury or flare-up in the past when going into this motion of flexion or bending forward or picking something up. So over time, your body and nervous system learn to protect against this. And the way it does this is through two separate things. The first is through communication, and the way your body and nervous system communicate with you is through pain. It's the way your body is trying to tell you not to do something or to be really careful with something. And the second is with stiffness, rigidity, or guarding in your back. It's that tight muscle knot sensation where it feels like your back is holding on for dear life. But it's usually doing this out of protection, out of a response to current or past symptoms. It's trying to prevent you from bending forward into a movement or position that it's worried about or thinks will cause harm. The problem is that this protection quickly becomes overprotection. It becomes a heightened pain response that ends up causing more problems than it solves. So this is the really key distinction to make when you get pain with a specific movement like bending forward. Because oftentimes we think that the pain is caused by this muscle tightness or muscle guarding, when in reality you might have plenty of muscle length or flexibility there, you just can't access it. Because your back is stuck in this overprotection mode where it's chronically tightened and guarded. So that leads us to the first big mistake that I see a lot of people making when they have pain with bending forward. And this is something that I was guilty of doing back when I was going through this. And that mistake is just constantly stretching muscles, thinking that you need to increase the length of the tissues in order to get out of pain. Again, a lot of that stiffness or guarding is neurological in nature, meaning that it's very likely that you actually have the requisite muscle length or flexibility in the things that you're trying to stretch out, but your body and nervous system are preventing you from accessing that full range of motion or full flexibility because it's worried about what will happen if you do. So instead of just stretching everything that feels tight or feels guarded, oftentimes a much better approach is to pursue pain-free repetitions of the movement that you're having trouble with. So in this case, bending forward. You might get pain if you try to bend forward all the way or if you try to pick up something from the ground with a rounded back, but there is probably some level of flexion or bending forward that your body can tolerate today and that won't set off the pain alarms. And that's really the key here. We have to find a tolerable, almost too easy starting point that you can begin getting pain-free repetitions with right now. You might start with just sitting at the edge of your bed or sitting on a chair and every day practicing slow, controlled repetitions of flexion. And the whole goal of this is to rewire that automatic pain reaction with bending forward. So you want it to feel almost too easy because we want to stack repetitions and stack evidence of pain-free flexion. So instead of stretching, where we're essentially forcing our body into an uncomfortable range of motion, what we're doing here is actually giving your body positive feedback on the movement that it struggles with. And that, compounded over weeks and months, is a really powerful tool to getting out of back pain. Another really powerful strategy you can use is what I call the pain pushback technique. So imagine you're going about your day and you're doing normal household chores, and you bend down to pull a plate out of the dishwasher and boom, you get that familiar zap of pain and the instant feedback that you shouldn't be doing that. Now, the typical natural response in a scenario like this is avoidance. You just got pain with the movement of bending forward. So you instantly trigger that overprotection alarm system and your body stiffens up and prevents you from going forward again. It's like you trip the alarm and then everything just shuts down. What you want to do in these moments is very gently push back on that avoidance cycle. Because if you automatically give into that avoidance and allow your body to stiffen up and not go into flexion, all you're going to do is reinforce that cycle that flexion or bending forward is something dangerous or harmful or something that you need to stay away from. So instead, we want to push back. And this is a really simple strategy. What you want to do is essentially recreate the movement that just caused pain, but in a less intense way. So you just pulled that plate out of the dishwasher going into flexion, and you got that instant pain and guarding response. What you want to do here is pause for a few seconds, take a deep breath, and just think to yourself, what's the smallest possible version of flexion that I can do right now that won't make my pain worse? This might look like standing exactly where you are and just practicing a few repetitions of forward flexion, but with a slower speed and less range of motion. Or maybe you do a more unweighted version where you support your body with your elbows on the counter and go through a few cycles of very slow and controlled back flexion. Or maybe you take 60 seconds to sit on the couch and practice a few seated variations. Now, this is not a quick fix. This is not designed to instantly get you out of pain in that moment. But what it does do is slowly breaks down that pain avoidance and hypersensitivity cycle. Instead of reinforcing to your body and nervous system that flexion and bending forward is something you need to stay away from, it reinforces that this movement is safe, it's okay to do, and that there's some version of it that isn't going to hurt you. The last really common mistake that most people end up making when they have back pain is spending a lot of their time focused on core bracing and stability. And I know that's controversial. A lot of the back pain experts make claims that core stability or core bracing and stiffness is the most important thing when it comes to back pain. And look, there's definitely a time and a place, and there's value to movements or exercises like that. But if you spend all your time trying to add more stiffness and more rigidity into the system, it's going to become a lot harder over time to overcome this problem of having pain with movements. It's kind of counterintuitive, but instead of avoiding the movements that cause pain, we actually need to approach them and practice them. We just need to do it in a slow, gradual way that doesn't trip those pain alarms. All right, let's summarize the 3 big things we talked about here so you have an actionable game plan going forward. The first change I would consider making is to cut back on some of the stretching. Anything where you feel like you're forcing your body into a position or just trying to stretch out specific muscles. And instead, what I would shift the focus to is small, scalable repetitions of the movements that actually give you the most trouble. The second thing is the pain pushback technique. So anytime you're going about your day and you trigger that pain and guarding response when bending forward, pause for a couple seconds, take a few deep breaths, and try to figure out what the smallest possible version of bending forward is that you can tolerate right now, and give your body some positive feedback that it can do that movement. And then finally, the last thing that I personally would focus a little bit less on is anything involving core bracing and stability. Again, it's not that that approach is all terrible and there's no reason to do any of it, but I would think about shifting your attention away from adding more stiffness and guarding and rigidity, more towards something like pain-free repetitions of movements that you struggle with. If you need more help with any of this or want a step-by-step process for all of these progressions and techniques, I would really invite you to check out what I do at BackUnbroken. I have a full system and process built around all of these concepts and really breaking people out of long-term back pain for good. It's helped hundreds and hundreds of people, and it might just do the same for you. There's a free trial, there's no hassle or gimmicks, and you can get started right away. So I'll leave the link down below if you want to check that out. Otherwise, thanks so much for watching. If you want to stay here on YouTube, check out this video next, and let me know if there's any topics or videos you want me to make in the future. I'll see you in the next video.